Please take your seats. The program is about to begin.
Every day, biotech scientists develop technologies that can help save the world. From pandemics, from food scarcity, and from the global climate crisis. Each year, BIO hosts the world's largest gathering of these scientists. But BIO is also the most effective voice of science and for science, promoting the facts while challenging misinformation and misguided policy that could cripple our industry and hurt our communities. And BIO continues to advance its lead as a comprehensive news source, from our free daily newsletter, Good Day Bio, to our award-winning podcast, I Am Bio. And today, we launch our latest resource for trusted industry updates, bio.news. This is your source of original reporting as well as engaging thought pieces from biotech experts. Stay in rhythm with the beating heart of our industry, the Good Day Bio newsletter, the I Am Bio podcast, and now, bio.news. Be informed, be engaged, and be active. Join us.
We've always blurred the boundaries, always seeking, then pushing the limits. But our world's upheaval forced our awakening, breaking down invisible walls, uniting us to develop solutions. And by building connections, by sharing more unique perspectives, we actually created less limits on our abilities, less limits for discoveries. And as the limits became less, our view broadened further, revealing BIO's new landscape, one of limitless possibilities, limitless breakthroughs that cure across the globe, limitless developments that protect our Earth, and limitless innovations that nourish our humanity. Our world catalyzed BIO's new era, and now there's no going back. We're reshaping our future, one with limitless potential for all. Please welcome President and Chief Executive Officer of the Biotechnology Innovation Organization, Dr. Michelle McMurray-Heath.
Good morning. It's been an incredible start to the convention, and I hope everyone has enjoyed the Bio Unbound keynote session yesterday. If you didn't get a chance to see it, it will be recorded as well. So there's such great energy everywhere I go, around the convention halls, around town. Everyone is reconnecting and making those important bridges for their businesses. So I love walking the hall, seeing so many new faces, and also reconnecting with old colleagues. So it has filled me with inspiration, pride, and a renewed purpose for achieving our collective goal of better serving our patients and our planet. So I hope you feel the same way. I also hope you are making the most of our partnering program. From what I hear, people are having great meetings and they are going back to back to back. And I hope you're attending as many of the educational sessions as you can. Fill in those calendars while you're here. We have a few more days left, and we have collected some brilliant minds in Bio 2022. So leaders are presenting their visions for the future as well as the latest industry research and trends. And we're just getting started. We have 2 more action-packed days to go. Venus Williams' interview with Erin Anders is coming up shortly, and this afternoon features key sessions on diversity and equity in our industry. And if you still have energy, When it comes to this evening, the party on the Midway takes place tonight. So it's never too early to think about what you're going to do in your last 2 days at Bio, and never too early to think about your next Bio conference. So I want to remind everyone that Bio Impact Agriculture and Environment Conference takes place in September in Omaha, and a month later, the Bio Patient and Health Advocacy Summit takes place in Washington, D.C. And don't forget, our Bio Investor Conferences will gather this fall and this winter, as you've come to expect. And this amazing event, the Bio International Convention, heads to Boston in 2023. But now, without further ado, let me introduce the chair of Bio's Board of Directors and the CEO of Nkarta Therapeutics, the one and only irrepressible Paul Hastings. Great to see
you. Good job. Together again. I mean, can you believe it? We're face to face thanks to the power of biotechnology. Now, our member companies, large and small, have done the impossible, creating vaccines faster than ever before, with the highest stakes in a century for global health. Now, we're never going to know how many millions of lives we've saved in this pandemic because so many biotech companies work together so tirelessly. To Bio members, Pfizer, Moderna, Johnson & Johnson, Gilead, Regeneron, Eli Lilly, Vir, GSK, Merck, Xencor, and Novavax, whose innovations saved lives and in many countries contained a deadly plague in record time. We say, thank you. Now, we still wonder sometimes if the world understands the enormity of what transpired in those early months of 2020. It's kind of something like you'd read in a Hollywood script, only science nonfiction. On January 11th, while the world slept, the Chinese government put the genetic sequence of SARS-CoV-2 online. And Moderna scientists, working together with the NIH, designed the vaccine literally on their computers. They didn't have access to the virus itself yet, but they had something even more important, its genetic code. 2 days later, Moderna's scientists had the vaccine designed. Talk about next-generation biotech. They decoded and neutralized a highly pathogenic, novel virus before ever putting it under a microscope. Now, if our industry can do that and get shots in arms in just 1 year's time, there's truly no limit to what we can accomplish. Now, I remember those surreal days in the early days. Our company, Nkarta, at our company, Nkarta, sanitation crews came through to wipe down the door handles in our building, inside and out, every single hour. We socially distanced our scientists in the labs, and we fought to designate our industry's scientists for what they truly are, the ultimate essential workers. And it's our responsibility to keep them safe. Now, at Nkarta, we weren't working on COVID-19 vaccines. We were working on a breakthrough to utilize the body's own natural killer cells to defeat cancer. Our vision is to bring cell therapy out of the intensive care unit into the community setting, dramatically expanding access for cancer patients. Biotech companies across our industry during COVID all found a way to keep going. Pause our research? Never. Biotech innovation never stops. Yet today, in the cruelest of ironies, the young companies at the vanguard of a revolution in medical research are fighting for our own lives. Biotech is bleeding. Hundreds of small and emerging biotechs are starved for capital and struggling to survive, a victim of the emerging post-pandemic world that our industry made possible. Venture funding is down 60%. Hundreds of promising companies are staring in the financial abyss, facing the prospect of running out of cash in a couple of years. And the global economic shocks of COVID-19 recovery, the uncertainty, the volatility, the inflation, the war in Ukraine, these factors are conspiring to cause retrenchment and reinvestment into less risky ventures. 96% of our clinical trials don't reach their desired endpoints. That's why in this bear market, even good data can lead to sell-offs and stock drops. Yet recently at Nkarta, we were fortunate enough to experience a trifecta. 2 cell therapy candidates simultaneously declared themselves with positive early-stage readouts, showing complete responses in patients with blood cancer, validating our platform. The preliminary data led to a stock increase of 140%. We were then able to raise $230 million in capital the very next day, helping us to keep innovating for patients. So I just have to believe that all is not lost. Investment will come back and innovation will be rewarded because the fundamentals of our industry are still strong. We're biotech. We're survivors, meaningful in purpose, fighting for patients. The truth is, we're waking up to a world that looks very different than it did just 2.5 years ago. A new normal of infectious disease threats and exposure to exotic pathogens that our immune systems have not evolved yet to fight. We need to listen to the evolutionary virologists telling us that COVID won't be the last pandemic we face in our lifetime. Now, biotech companies are poised to answer this call and unlock the secrets to conquer so many diseases, but we must have the resources to do that. Too many folks in Washington still have the wrong impression about who we are, as if we're causing and not solving mankind's greatest problems. They want to slash the wholesale costs of new medicines, they want to waive our intellectual property protections, and limit our data exclusivity. Politicians who praise our industry for providing COVID-19 vaccines in record time, only to undermine our ecosystem and drain our resources at humanity's expense, are playing a dangerous game. Governments incentivize and invest in the things they value. What matters more right now than biomedical innovation? In times like this, honoring our social contract is especially important, in my opinion. Our companies must be allowed to price our medicines for a return on investment. But when patents expire, let those drugs and biologics go generic without undue complication or delay. That is how we will win the trust back on Capitol Hill. And we must because the world needs us. We face many threats as CEOs. Our employees, boards, and investors want us to use the platform we've been given and not stay silent. So as an individual, I won't be muzzled when limits are being placed on our most basic human rights, civil rights, women's rights, gay rights, and the right to democracy itself. So in the face of these challenges, it's the job of leaders to stand up and lead. Now, I'm currently leading my 5th biotech company, but long before I was a CEO, I was a patient advocate. At 13, I was diagnosed with severe Crohn's disease. Sorry about that. So at 19, I traded my colon for a life free of pain but full of purpose. Now, working in biotech since 1984, I've learned that partnerships with patient advocates are among the most important in our industry. We exist so that patients benefit from us, not the other way around. Now, if you want to know what motivates me, look no further than Brian LaRue. He almost died at childbirth. They lost his heart rate. broke his clavicles, forcibly removing him from his mother's womb, stretched his spinal cord. To this day, he lives in involuntary muscle contractions, tremors, spasms, limited function in his lower extremities. But when he was 7, his mom found a skeletal muscle relaxant developed by a company in this room that relaxed his spasms and helped him unclench his frozen fists. When he was 14, he first attended a summer camp run by a patient advocacy organization that I chair for youth with 54 diagnoses of the bowel and bladder. Now, it was there at Youth Rally where he met another kid just like him. Sterling was also in a wheelchair. One day, they went to visit the rock wall to see what the fuss was all about. Now, Brian wanted to prove something to Sterling, so he approached Alex, the climbing instructor, a former Youth Rally camper himself. Now, as a baby, Alex was given up by his birth parents to a Chinese orphanage because he had a birth defect in his gastrointestinal tract. But he was adopted by a single mom here in the United States who never gave up on him. Today, he's a colorectal surgeon. Thank you for that pause. That helps. All right. So now at the base of the wall, Brian asked Alex if he'd help him make it up a couple of rungs. The wall was, after all, a telephone and a pole and a half high. And what happened in the next few minutes, Brian will tell you, was the foundation of everything he's accomplished in his life since. Starting his own business, building a Facebook community of 40,000, and his current job as VP of Sales at a solar panel company. The muscle relaxant allowed him to grip the rocks, and Alex positioned Brian's feet on the first toehold. With all his might, Brian pulled with his arms while Alex pushed underneath. Together, grunt by grunt, they began to scale that wall. And as they ascended, a group of campers gathered to watch, joined by me in absolute slack-jawed amazement. When they finally reached the top, drenched in sweat, Brian looked down and saw his discarded wheelchair and his stunned fellow campers. Then he saw his friend Sterling, and he began to cry, just like me, a mess, right? So did I. This is why we do what we do. So, I'm done, thank goodness. If we support one another, keep the faith, never relent as we make that climb against all the odds, we will weather this storm. And our potential to create miracles will be truly limitless. Thank you. Okay. So early this year, our partners at Science History Institute recognized a leader who has advanced innovation and improved the lives of patients. This year's honoree helped transform San Diego into the powerhouse for biotechnology breakthroughs that it is. He is a pioneer and a champion for so much of the innovation that happened across this region. Dr. Ivor Royston was the co-founder of San Diego's first biotechnology company and has been instrumental in the formation, the financing, and the development of numerous companies throughout his career. Now today, he is the president and CEO of Viracta Therapeutics, a local company focused on novel therapies for viral-associated cancers. And he's also the winner of this year's Biotechnology Heritage Award. Please take a look.
Ivor is very curious. He's persuasive. He's inspirational, and he's persistent.
He's innovative and he's tenacious.
He's a risk taker and he's bold.
When I think of Ivor, I think of two things, joy and generosity.
Ivor is a Renaissance man.
He's dedicated, consummate entrepreneur.
Ivor has always been an inspirational leader. From the time I first met him 44 years ago.
Ivor was a real pioneer because industry and academia had, in those days, were quite separate. At Hypertech, he brought the science to the management and industry know-how, how to develop something.
He also was a team builder. You know, when you want to solve these big, hairy problems, you don't do them by yourself.
He really approaches problems without a fear of failure, and that's thinking all things are possible, and that's what he did.
And the success that the city has had has been very much influenced and determined by the example that he set.
Well, I think my proudest accomplishment is what I've done for the city of San Diego, and being able to show that you can, in an academic environment, be involved with industry and companies, which of course now is very commonplace.
Ivor's role was equally important in the creation of an industry that was able to work to bring technology and intellectual property and therapies really from the bench to the clinic to patients.
He's a tremendous advocate for patients.
With Ivor's help, a drug was developed that he recommended to my wife for cancer treatment, and it saved her life.
As a 14-year-old, he declared that he would devote his life to curing cancer. Imagine that.
He's still got that, sort of childlike hunger to continue to make a difference.
His patients are still first, and he wants to save lives. And I think when you have that kind of a goal, it keeps you going.
My whole life has been really driven about developing new cancer treatments. What I've learned is that I can do it better by working with industry. We're making such great strides in curing disease. All the big diseases that afflict mankind are going to be solved someday.
Ivor deserves this award because of the impact that he has had in promoting biotech as a way of curing disease.
I think the legacy is really what he started in San Diego and what he's done for patients and families.
Ivor has been one of the biggest philanthropists in the life science community and in the community in general.
With the La Jolla Playhouse and the San Diego Symphony, longtime supporters like Ivor have really played a role in strengthening those institutions.
That's what I meant by saying Renaissance man. I don't know very many people who've been Cancer Center director, CEO, successful venture capitalist, Tony-winning Broadway producer, and back to CEO again.
Ivor, congratulations on receiving this award. And as always, I cannot wait to see what you do next.
So now it's my distinct honor to introduce the next session. Our speaker is a trailblazer, a fierce advocate, a successful entrepreneur, and a champion who has shined and excelled both on and off the court. Venus Williams learned her craft here in California. And through hard work, determination, grit, and passion, she became a 4-time gold medalist and 7-time Grand Slam singles champion. But perhaps more importantly, she has become a role model and inspiration for young women around the world. Moderating today's conversation is a reporter, Erin Andrews. Now, Erin has been a long champion for women in sports. She's also been critical in efforts to raise awareness for cervical cancer. Please give a warm bio welcome to Venus Williams and Erin Andrews.
Hi guys, how are you? I'm jealous. Somebody wore sneakers. She beat me to it. How you doing?
I'm well. Hi everyone. How are you?
So this is day 2 of this conference, right? Day 2, you don't ever really have to do these conferences. We do them at Fox Sports. By day 2, you're pretty over it, right? You're just like, all right, let's go. Pool time? Did anyone get pool time yet? Okay. Sounds like they're still into it. That's why you're here, day 2, because everybody wants to hear about you. I was reading up a little bit on your Bio International Convention, and Venus, I don't know if you know this, the theme for this year is limitless. And when I was just diving into a ton of articles about you, your life, watching the amazing movie that came out about your dad, did you really sing Whitney Houston songs all the time? Was that you growing up?
Oh, if anyone has seen the film, Serena used to sing.
Oh, it was Serena, yeah.
And she was the youngest, and then my older sister who judged the contest, no matter how many times she sang the song, Serena won the contest.
What was your song?
She's been winning ever since.
Did you have a go-to song?
No, I thankfully stuck to sports.
Yeah. Did pretty well with that. But yeah, so the theme is limitless, and just reading about you, reading about your family, you were the perfect definition of that. And of course here, we're gonna talk about your health journey, which you didn't make it seem like you were limited, and it certainly didn't stop you, but we don't know what went on behind the scenes, and we want to uncover that today. 2011, take us back. You unveiled to everyone in 2011 you were dealing with an autoimmune disease, but before we get to that and when you went public with it, what were you going through? What made you feel like, okay, something's wrong, something's not right?
Yeah, so I was diagnosed with an autoimmune disease called Sjogren's syndrome. It's when you put an S and a J together and suddenly you come up with this disease. And that's what I got. So before that, I just felt like I could never get into shape. And it made me feel lazy because all I've ever done is work hard, and it was very difficult to work hard, and I still worked, but I didn't want to do it because I felt so bad. And I would periodically go to the doctors and say, I don't feel well, I can't, I'm constantly exhausted. And that kind of went on for about 7 years before I finally just got too sick to continue playing professional tennis.
So 2011, you come out, but you said 7 years this was going on. You felt fatigued, which how are you even having success in your job and in your career when you're feeling that way? I mean, my gosh, how would you get past how bad you were feeling?
No limits. Honestly, it wasn't easy. Still isn't. But I asked in my life for not for less challenges, but for more skills. So in that sense, it started to become a mental thing. You know, how much could I take on mentally? How much more capacity could I take on? And starting to, what I would tell myself is to think about what I could achieve and what I couldn't, because it's scary when you have those proposed limits. And also, I tried to think about the glass half full instead of half empty, or completely empty at times. And that's life. And I thought, this is a challenge, and I like to live life on my own terms and not in any other way. So for me, it was about living life on my terms. And even if it was being taken away by something out of my control, I still wanted to live my life on my own terms. So that was all the pushback that I was giving this Sjogren's thing.
So 6-7 years you're dealing with this, and I love what you said, because in my own health journey with cervical cancer, you have to be your best advocate. You have to, you know, if you're not happy with what doctors are telling you, sorry. You got to push to get the information you needed. So what were those 6-7 years like that you're trying to get the answers? I mean, tell us what you were going through.
Yeah, I don't think doctors like me. I'm so sorry.
So sorry.
I'm the kind of patient that's come in and done, you know, weeks of research, and I know exactly what I want and what I need, but I do have to be responsible for my own health. And I think in that sense it's a partnership, right, with the patient and the doctor, so that way you can communicate what you need, and also you're able to understand what's happening with you. When you understand that more, you're able to move forward more. And I feel that way with all my injuries, and also with Sjogren's as well. But I just remember one summer, I just was sitting in the chair, and sitting in the chair was just so unbelievably hard. And I just started asking everyone around me, my coach and my physio at the time, I said, are you guys tired? Everybody's like, no. And then I started to realize that it was me. I was the one, like, at that point, sitting in a chair became difficult. Waking up in the morning was difficult. Laying in bed was just too hard, you know, painful. So at that point in time, it was a bit of a lonely summer. Everybody was on tour. I wasn't. I still went to practice, but it was just intense. And in that sense, that was kind of a beginning of a new journey for me. At least at that point, having a diagnosis made me feel like I wasn't crazy. You know, like, okay, at least there's a name to what I'm going through, and maybe I can start to face it now and start to move forward.
When, I don't know if it was whoever it was that said, this is what you're dealing with, what was your first thought? I mean, I'm sure you probably didn't know much about it. Was it panic? Was it relief that they knew? What were you dealing with?
I think it was definitely relief. It's a long journey after 7 years. And no one wants to be sick. No one wants to be dealing with a chronic illness. But at the same time, it gives you some sort of stepping stone to start to step upward, and start to receive treatment, start to feel better. And for me, that my whole family supported me a lot in this. So my sister told me, Serena, she said, well, there's this health center next, you should go. But she didn't go. But my mom went with me, and my older sister went with me, and we started adopting like different techniques for more anti-inflammatory diet. And my dad doesn't really know how to do it. He still thinks that like iceberg lettuce with ranch dressing is healthy. But he's doing his best. So everyone like adopted this different healthy eating lifestyle, and I love health and wellness. That was, even without tennis, that's always been my pursuit because of the way I grew up. So it just became even more of a passion for me, and it's wonderful to see. I was listening to the speech earlier. It was just amazing to hear all of those things, and it's so exciting to hear that, because I have an illness where you look like you're healthy, but you aren't. So what I go through on a daily basis, when I wake up, before I go to bed, how I feel when I'm on the court, I feel very stoic about it. No one knows what I'm going through. So no one really knows what each person is going through, but it's wonderful to know that everyone in this audience today, there's so many people who want to help.
Yeah. And the sports reporter in me will say, you're dealing with so much, but as a lot of people were saying when it was the US Open, right? You pulled out because you weren't feeling well and in 2011. When is she going to be back? When are you going to be able to play? It's not that we don't remember the human element of this, because I'll be completely honest, my husband is a retired NHL player, and he dealt with a lot of health issues that we were wondering if that was going to curb his career. But it's the number one thought for a lot of people, and I'm sure it was in your mind as well. When did you find out through maybe the diagnosis that you would be in fact able to play with it?
Yeah, so I used to be at home a lot, and I would sing a lot of karaoke because if you feel a little down, if you ever guys sing or dance, it really brings you up, right? But I was too out of breath to really sing, but I would still go for those ballads, Journey, whatever.
I was going to say, what was your go-to?
It wasn't great, but, and I think what really lifted me was the Olympics. I just knew I had to get to the Olympics, and it was 2012, it was London, and I loved the Olympics. And the Olympics it isn't really a tradition in tennis, because it just came back as an Olympic sport in maybe '88, and before that it wasn't around until 1922. But my dad would have us watch all these films, and we'd have to watch these Olympic films, and it was part of our mental training. So we would watch, and I was like 8 years old, so we'd watch Greg Louganis and Jackie Joyner-Kersee and all these things that they would do at the Olympics. And my dad loved the Olympics, so I went for him the first time in 2000. But when I got there, if you ever have a chance to go, it is the most beautiful feeling to be a participant, to be a volunteer, to be someone who goes. It's incredible. And that's what I found out. So I needed to get back to this incredible place in 2012, and I had to qualify. And so I definitely came back a lot sooner than what I ideally would have wanted to, but I had to get to the Olympics, So that was definitely motivation for me.
How'd you do it? What got you through? I mean, you mentioned leaning on your family, karaoke ballads. which sound incredible. In fact, let's throw it to a highlight. No, I'm kidding. We don't have that.
How did you find that?
I was kidding. But how'd you manage? How'd you, you had this goal with the Olympics, but how'd you do it with your health? You're dealing with physical, something physical that you have to deal with, along with the mental, by the way.
Yes. Basically, it's like a box of chocolates. You never know what you're going to get. You're going to wake up, you never know what's going to be. But I had to just take what I had and start going with it. And definitely every time that you get knocked down, which in this sense is all the time, you just get right back up. You get a bruise and you say, give me some more. And I think that's what I got used to. But I think also sport prepared me for that. It definitely did.
What way? You're so good at this. You obviously have been around a lot of reporters. What, being an athlete, helped you deal with this?
Yes, resilience. And then even talking about no limits, because no matter when we say no limits in our mind, there still is a little bit of a limit. You don't realize, you're like, maybe could never do that. And the people who don't necessarily have those limits, they're probably a little bit off. So you got to have some sort of safety so you don't press the red button. So definitely on the court, there were times where I would walk off and I don't know how I won that match. I was going down. It was over, but it happened. So I think that teaches you every single time that you still have to not put limits on yourself, even the perceived ones that are in the subconscious.
Was there, or maybe what was the biggest surprise about the journey? Maybe coming back, trying to make it for the Olympics with this new diagnosis. Anything that shocked you about the whole journey? You're still on it.
I'm still on it. Yeah, anytime I have a flare-up, the first thing I think is, what did I do wrong? What did I do wrong? What did I do wrong? And it's just, you can't control it. But I physically need to be at my best. So it's still a journey. I think what I learned more than anything was to let go of fear. I would walk on the court and be afraid. I would walk on the court and be afraid of what I couldn't give, or when I would run out of gas, or what point I couldn't play, or those kinds of things. And eventually, and it took a long time, but just to not be afraid anymore, even though there was plenty to fear, just to let it go and just get started and get going. And that, I think, was the biggest lesson that I took from it. It's just this new level of being fearless.
I'm going to be Tom Rinaldi for a second right now. I know you've dealt with him. What was the biggest thing you were afraid of?
Definitely, tennis is a sport, and any sport or life is a sport of endurance, right? You got to keep going. You got to keep going past that line until you finally get there. And one of the best things in tennis is just to be able to out-endure your opponent. No matter what, you just keep getting the ball back, keep getting the ball in play. And so if you have limits physically, then you can't mentally push your opponent to that place where they just say, hey, I've had enough, you win. I can't face you any longer. So at the highest levels, that's what you have to be able to do. And so walking out there knowing that I didn't really have that in my repertoire was hard. So I just had to let it go somehow and find another way, whatever way that was.
And you have, and I think one of the most important ways that you have is you went public with this. You are a voice now for others, whether you chose to be or not. That's how I kind of felt with cervical cancer. I didn't ask to be a part of this sorority, but now I'll be your spokesperson. Why is that so important to you, being an advocate?
Well, my mom encouraged me because I just wanted to withdraw and go to my quiet place, because I'm an introvert. I'm not a huge sharer. And this is 2011, so all these kinds of things, now you can talk about everything, Yeah. Mental health, and that was another time, it feels like. So it's hard to show weakness, and especially as an athlete, the last thing I want my opponents to know is exactly what I'm going through. So that was definitely very difficult, but I think good things come out of it, and I think it encourages a lot of people.
Yeah, and definitely, like we talked about, never stop trying is a quote I've read you say quite a bit about this whole journey. Be an advocate for yourself. why do you stress that with others? Because, I mean, we opened by talking about that. Not that we don't appreciate the opinion, but you have to get the information. And if you're not getting it, you have to try somewhere else. What do you think about that?
Yeah, absolutely. And you do have to be an advocate for yourself, and you have to stay encouraged, because you can feel discouraged, especially when things aren't working and you hit another wall and another wall and another wall. But the alternative is to lay down on the ground, and the ground is dirty. It's not sanitary down there. So better to get up, breathe some clean air, and keep it moving.
Yeah, that ground, pretty dirty. Not only are you dealing with how you're feeling, you're tired, you hurt, but you also had to deal with the mental aspect of it all, which as a professional athlete and all the pressure that's already on you is not easy at all. What was the hardest part with that?
I think the hardest part was that it's just my own expectation and failing what feels like or felt like myself, and knowing I can be better, but I wasn't, and feeling like a mental midget at times, like I can do better. Why did I miss that shot? Why did I get tired? All the different things that I felt, and being able to get through that and work through that mentally. And I think that at this point in time now, sports psychologists are a regular part of an athlete's team, but not back in 2011. So you had to tough it out.
Which is crazy if you think about it, right? It's such an easy thing to talk about, and you always see sports psychologists with football teams, but not back then. It's really incredible.
It's really incredible what's happened in the last 10 years. So that's definitely an important part of a patient's ability to move forward and to cope with what they're dealing with, is also dealing with that mental aspect that goes along with everything else that you're going through.
How'd you do it? Since mental health wasn't really a big conversation in sports in 2011, how did you make sure you were mentally okay?
Well, life is about enjoying yourself, right? And being able to look back, even in the worst of times, and smile and say, I enjoyed my life. So I definitely believe in that. So even if it was the worst of times, I would still do things to be able to enjoy my life. Like, I look back on maybe my last clay court season. I don't think I won a match. It was terrible. But when I look back, I had a good time. I ate good food, maybe too much. I went to museums, and it was terrible in terms of tennis, but I still enjoyed those moments. So no matter what the terrible time was, even in the worst of times, you have to enjoy your life. And I can't remember the question now, but I hope I answered.
It doesn't even matter. By the way, it was probably pretty terrible. No, but it led into my next one, which is, what advice would you have for others in making sure your mentals, as Marshawn Lynch would say, or just making sure you're okay? Any advice?
I would say, first of all, just acknowledging where you're at. And a lot of times, unless we do that check-in with ourselves, you don't even know where you're at. When you're going through something, you have all these emotions, and you got to figure out which one is the one that's actually bothering you. So I always recommend writing down all the things that are bothering you, and then you kind of start to pick out which ones are just pure emotion, and which one is oh, this is what actually is bothering me, and this is what I have to actually work through. And just acknowledging where you are at that time, and having that support, and realizing that, as cheesy as this sounds, that if you get to the other side, you'll be okay. I was talking to a friend of mine, and those friends who are always having relationship issues.
Yes.
And I was talking to this character, and he was nice, but he wasn't the person to date. So I said I had to just say, let's be friends. And I said, if I just get to the other side, I'll be all right. And she started laughing, but it's true. You get to the other side, it'll be okay. And it's just about getting to the other side. Sometimes that feels far. So you got to take a few rest stops, karaoke, whatever that is to get you through, you got to get there.
Sure do. Thank you for sharing that. That was amazing. Can we talk a little tennis right now?
Sure,
your career?
I love tennis.
Yes.
Any tennis players in the house? I don't know. Did you guys just hear that Serena is playing Wimbledon? Right?
I didn't know if I could bring that up. It wasn't on the suggested questions here. What are your thoughts on that?
I've been keeping this secret for a long time, and I'm just glad it's out. You know how many people ask you, I heard, I'm like, I don't know. And you feel like you're lying. You're like, just leave me out of this. But I'm super excited. She hasn't played in a year. I haven't played in a year or two. So it's going to be great to see her back in action. And she's quite formidable.
Yeah, I would say, right?
Yeah.
I don't know if security will come and tackle me for asking this, but the follow-up question is, when do we get to see you back out there? Any idea? No pressure. We could go sing some karaoke before you announce it.
Yeah, I'm in the incubator. That's the best way to put it.
What? I'm sorry, what?
I'm still incubating. I'm like in the little test tube. Yeah.
Do you have the itch though? What's that like? You just said you haven't been out there in a year, right? I mean, is it hard? Are you enjoying the break? What's it been like?
I think it's made me appreciate it much more, and I have a new love for the game, and it's just so fun. It's so much fun, and I can't wait to see her and support her, obviously.
Yeah, what's that like? I mean, I know you've been asked that 17. How many times do you think you've been asked that?
So many times that which part?
How many? What's it like watching your sister play?
It's nerve-wracking.
It is?
Like, there'll be times where she's playing an Australian Open final, and I want to sleep through it just so I can wake up because I'm nervous.
This result, yeah.
Yeah, and I'll wake up anyway. And I'm like checking the scores, freaking out, all kinds of things. Like, I don't know why I can't get used to it, because my hopes and dreams are with her too, you know?
Of course. And maybe really a stupid question. Are you so cognizant? I mean, every time anything happens, the camera's going on in the box where you guys are. They want to see what, especially if you're sitting there, the reaction. Yeah. Are you cognizant of that, or you're like, I don't even care. This is my sister.
No, because I'm okay, but my mom has fallen asleep a few times. She really did. But then there's other times where she'll clap for it, like it'll be a good point, and she claps for my opponent, and afterwards say, Mom, I lost that point. And she's like, but what? It was a good point. I was like, you only should clap for me. And it's like I go back to being a 10-year-old, you know? She's like, why are you mad? I was like, she's not supposed to want to beat me. And she's like, she's not supposed to want to beat you? I'm like, no. So that has never been resolved in this since I've been pro.
Why would it though, right? But yes, exciting news about your sister. Can't wait to see you back out there again as well. This resonates with me, working in a male-dominated industry. I'm sure a lot of the women in this room understand that as well. Sports, medicine, sports. When did it click for you? And I know this probably sounds dumb saying, when I first got in the industry, I was just so excited to be there. I'm working college football, I'm doing NFL. I didn't care there weren't many women in the industry. Then once you've been around for a while, you're like, pays a little different. Treated a little different. When did it click for you it was a tad different being a female in tennis?
Yeah, for me, it clicked differently when I got to Wimbledon. I was 16 years old. It was the 90s, guys. And when I got there, I wasn't paid equally. Now, granted, it didn't go that great. I lost first round. It was my first time, but then when I did lose first round, my first round check was different than the men's first round check loser. So that definitely was a bold awakening. And that's a tough thing to face as a 16-year-old. And I never wanted any other 16-year-old girl to have to go through that. Thankfully now, they don't have to. But there's still a lot of 16-year-old girls outside of tennis who are facing that inequity. So it's so important for people to know about it. I don't think anyone in this room woke up today, man or woman, and said, gosh, my colleague is being paid less than me. So, right? It's not something you may think about every day. So it's important to have those thoughts. It's important to have these conversations. It's important for organizations to have strategies in place to make sure that these things aren't happening, training, all of those things. So that's why we have to talk about it, because no one wakes up thinking about it, right?
But what I find so incredible is you're telling me as a 16-year-old you were having these thoughts. What'd you do? Who'd you talk to about it? Your dad? How'd you handle it?
Well, I had a lot of other things to figure out at that point. Like my hair was a little rough.
Stop. Whose wasn't at 16? Knock it off.
There were a few things.
Legs for days. You were killing it. Knock it off.
You know, at the time, you aren't able to really put words to it. But, and there were a lot of things I needed to figure out in my tennis game, too. So there were other priorities. But over time, as I was able to mature, I was able to put work into it and give words to it, and thank God.
There's obviously been a lot of discussion with it around soccer. I was actually interested when I read that. Have any of those women come to you for advice? Or I didn't realize it. Have they?
Right. They all go to Billie Jean King, actually.
Yeah,
so
for sure.
She's the go-to
Yes,
for that. Maybe one day they'll come to me. But right now, I'm not joking, they do go to her.
Oh, I'm sure. Yes, of course. And what kind of advice does she share maybe that's resonated with you that you kind of carry on?
Billie Jean is very special. I have a job because of her. She started the WTA tour, so I get to go out there and raise hell because of that. And she's just very special. There's a team competition called Fed Cup. It's like Davis Cup. And we'd just be out there. She was the coach playing, and all of a sudden you would hear, "I love this game!" And you're like, wait, what's going on? So she's just so enthusiastic. She has this unbelievable energy. Some of the things she says, like pressure is a privilege, all those different things that is so inspirational. So it doesn't really take much to be motivated by her. And all women from all sports just are giving her calls to figure out how to make that next move forward in their own sport.
I love that. Pressure is a privilege. What other Billie Jean-isms are there? Any good ones?
The other one, pay the price. Pay the price.
What does she mean by that?
Well, I like to laugh and joke a lot. I don't know if you can tell, but we were once playing another Fed Cup, and one of our teammates, she wasn't playing maybe the best match, and Billie's just stressed out, and we're on the sidelines, and she's saying she's not paying the price, and she's like just talking to herself. She's not paying the price. She's not paying the price. And I'm over there biting my cheeks trying not to laugh, But ever since then, we would say, you got to pay the price. There's always a price. There's a price to be successful, and there's a price to be unsuccessful. Both prices are high, and it's about which one you're going to pay. So ever since then, Serena and I always said, you got to pay the price.
I love it. Who else do you look up to in the sports world? Doesn't have to be tennis.
Can I pick Serena?
Sure can.
No, but I do. She really made a huge difference in my career. I was the older sister, so I was supposed to be first and supposed to be the role model. In a lot of ways I was, but she was the first one to win a Grand Slam. And I learned so much from her. She was fearless, and she had a huge heart, so much courage. And I had a lot of talent, but not necessarily the heart. And watching her, I learned that. And I wanted it, and I got it because of her. So without her, I don't know if I could have ever achieved any of the levels that I wanted to. So she was a huge role model for me.
When we talk about Limitless, and obviously we said that this is this theme of the Bio International Convention, we talk about your sister. We all know the story about your family. What else pushes you in breaking records, going past boundaries? What motivates you? What pushes you when it all comes down to it? That's why I ask you about maybe other people you look up to.
Yeah, love, passion. When you love something, you want to push forward. If you don't love it, you're over it. It's pulling teeth. So the love for it is so important. The passion for it is so important. You have to be passionate about things, and if you aren't, better to move on to something else so you can feel that love, because when it's love, it's beautiful. And so for me, that's what it's about. I truly love what I'm doing, so it makes me so happy, and so that means I have something left to give. And when I feel like I have nothing left to give, then I know that it's time to move on to the next passion.
I just saw that they put that's a wrap up, but before we do that, you have a birthday coming up?
Yes, I'm getting younger. I'm
yes,
gonna be
you
25. Are. It's this new science, you guys.
Thursday, right? Is it Thursday?
I don't know. Yeah, 17th, whatever day that is.
I think that's, Friday? Maybe Friday?
Maybe Friday.
42? Yeah. I'm 44. Yeah. You look great, girl. Thanks
you.
For making us 40-year-olds feel so good. And thanks for doing this. A lot of stuff you were saying was giving me goosebumps. And also, thanks for sharing your story and being an advocate. I just feel like anytime somebody like you is able to get your message out, it does mean so much to so many people. So it's a pleasure.
Thank you, guys. Thank you so much.
So I have some final last words for you guys from the Bio International Convention. Don't forget to join us tonight at our closing reception. Venus and I will not be there, but I'm sure you guys will have a blast. And of course, looking forward to seeing everybody in the 2023 convention in Boston. I love Boston. Do you ever spend much time out there?
Not enough.
It's a time. Go Red Sox, go Celtics. I'm not a Patriots fan, but they're fun. It's going to be a wicked time in Boston. Thank you guys so much.
I'm making you sweat like that. Break it down. Ooh, when I look in the mirror, I'm not too hard to do. I got the superstar glow, so ooh, do the boogie. A side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you 'cause talk is cheap. Side step right left to my beat. Get it, let it roll. Smooth like butter. Pour you in like no other. Don't need no usher to remind me you got it back.